Hello and welcome everyone. Today we are here on a new topic in the Lipedema Awareness Month about lipedema. I'm so glad that this is the second or the third live session that I'm conducting for lipedema because this is one of the biggest concerns in India, which is not spoken as often the other problems are being spoken. We have Dr. Srinagesh with us, the person who's ideally introduced lipedema problems in India and has spoken loud and clear about it since the period nobody ever knew what lipedema was and were confused between what is lipedema and obesity. I also want to congratulate Dr. Srinagesh on the occasion that your lipedema ebook is getting highly downloaded by people and people are watching it so high and you're getting so many questions. I think it's a great initiative that you've introduced an ebook and talking about it, as well as your website, which is creating the best awareness for people to understand what lipedema is and to know more about it.
Thank
Dr.
you.
Sheena, anything that you would like to share about and also introduce the warriors to us, sir?
Yeah, thank you, Mukesh, for having introduced me this way. It was a pleasant surprise for me, but yes, like you said that I have been working on lipedema almost since 2010. Uh, my journey to lipedema was actually it is, I could say, it's a family affair because my wife has lipedema and she used to suffer from lipedema. She was quite symptomatic. She used to have pains and everything, and she used to, you know, her lower body used to keep on progressively keep increasing in size, and she used to feel quite embarrassed, and she also had some pains and other things. So because of which she used to suffer. And initially, soon after our marriage, for a couple of years, I would say, I used to actually think that she was faking all these things, so that she can avoid, socializing and other aspects, some other aspects. And then subsequently, after our second daughter, a daughter was born. I started observing that she was finding it difficult to keep the baby on her lap, and then I realized that no mother would try to put the baby into somebody else's lap or besides, and even when the baby is crying and wants to be in the mother's lap. Because then I realized that something is wrong, and something is wrong with me in my thinking rather than the what she was suffering from. And then I started researching on this, learnt about it. Then I had gone to Germany, spoke to a couple of doctors there, got trained, then imported the equipment from there, came back, and I don't know whether to say that whether she was my first patient or she was my first victim, or I was the first victim, being the husband of a lipedema sufferer. And as a husband, me operating on my own wife, that was quite nightmarish, I would say. Because if something goes wrong, then for the rest of my life, I'll have to face music. Uh,
So we're going to
uh,
correct, I'm going to correct my statement saying that the pioneer in India is Dr. Sita Lakshmi and Dr. Srinagesh, because if she was not lipedema, you would have never got this so high. And
yes, if she didn't have lipedema, then maybe I would not have even bothered about it. Maybe we don't know. So if fate brought me into this, and then subsequently looking at the relief that she got after the procedure, then both of us, sat down, started thinking about it, and then did further research, saw that this particular disease is not known to people almost across the globe. Very little awareness, unfortunately, and then so we used to try our bit, and for almost 7 years, we couldn't make any headway because WHO had not recognized this as a disease. So if we start promoting this or talking about it out loud, we used to face brickbats from our own colleagues. And Then we also thought that if we go a little overboard, then there could be legal issues which we would not be able to face. So we had to go slow. It was only after 2019 when we launched our website, and then the rest is history.
Right, sir. Right. We are also glad that we have both the warriors. We have lots of warriors, but we have two warriors who have taken up the stand to come and help us creating awareness about lipedema. So I first of all want to thank Neeti madam and Sukoon ma'am for being here and sharing up your journeys. Dr. Srinagesh, if you could share some things about both of them.
Yeah. What should I say? Yeah, Sukoon had come over almost a year ago, I think so, if I'm not wrong.
Two
Yeah, she
years.
came, yeah,
Two
twice,
years.
2 years
Two
back.
2 years ago, yeah.
Yeah, 2 years ago she came. She grilled me with all her questions, and then she left. And then subsequently, I think almost around 2 months, 3 months back, she again came back, and by then, as doctors have relatively poor memory, I did forget, and then she reminded me, and then I recollected, about her, and then she was quite enthusiastic. But of course, like any other person, a young lady, was a little confused whether to do it or not to do. This was a dilemma. And then subsequently, she realized that it's better that she goes ahead with the procedure. Explain to her in detail, and then of course she's quite fortunate that her parents were quite supportive. So they came over. They also had their own doubts, which after they were cleared, then she underwent the first procedure. So I think she will be able to tell her part of the story subsequently.
I'm definitely here to ask more questions to her and get it up.
Yeah.
Something about that question about Neeti
And
also.
Neeti, yes, she is, I think, this girl Sukoon, she is from Hyderabad itself. So she has more easy access to me. You know, and Neeti is from Bangalore. So she initially had a online consultation, and then subsequently, on an online consultation, it is really difficult to really make a proper assessment, because unless and until you examine, feel the skin, feel the lipedema tissue, the nodules, or any other things that are being missed out, like spider veins or varicose veins or bruises and such other things. It is, you may not be able to come to a conclusive diagnosis of lipedema. You may get confused, and you may wrongly say brand it as a lipedema, or wrongly brand it as obesity or lymphedema or something like that. So and of course we do also have Dr. Pinjala Ramakrishna, who is an experienced vascular surgeon, who also is quite knowledgeable and is quite supportive, and is quite helpful. So he handles all the vascular issues if there are any in my patients, lipedema patients. And then subsequently, we take over. Sometimes these vascular problems may appear quite gross, but once the lipedema fat is removed, the veins shrink, and the lymphatics start to behave much better, and so they fare much better. So so these are all the things that we look into. Neeti also, she came down with her husband. Her husband has been very proactive and supportive. So he came down with her, and then she also got her first procedure done, and then she's again gone back to Bangalore, and she's already sitting here with us. So she will share her part of the story.
Right. So like everybody, you've given a great introduction, and like all of us know that lipedema. I mean, many of us may not know what lipedema is, but I think the best way to find it out is download the ebook, which is available on the website www.lipedema.in, and you will find a lot of things which will be surprising. I want to ask this question to you people because before you guys met, sir, there was no ebook in India, there was no communication in India. Neeti ma'am, especially I'm raising this question to you, and maybe I'll pass the same question to Sukoon ma'am after this. The question is that how was it difficult before you even identified that lipedema? What all went across you, and what was happening around with you?
So, before I came to know about this that I have lipedema, I was just thinking like this is either genetics. Like I'm meant to have this body shape because I'm not the only person who's having. My mother has also the same issue. Like the upper body is very thin and the lower body is very bulky. So I thought it was genetics and obesity. So I tried many things like workout. You can name anything. Um, Keto diet, high intensity workout, anything you say, any diet you say, that I have done it. But whenever I used to undergo that, I used to lose weight rapidly in my upper body, but very little or no significant loss in the lower body. So one day I was just scrolling through YouTube, and there I found a girl who was sharing her journey for lipedema. So I was able to connect very much with her because she has a similar issue. And after that, I researched some on my own, and then I found that okay, so this is something that I could be having. And then I started having find a cure for it and how it could be prevented. So and then I met Dr. Srinagesh like that.
I'm going to ask the same question to Sukoon ma'am. How was it before you could even identify about this and talk about this? What was your experience and what was your thought?
So in my case, it was very similar to Niti. My mom had the same genetics, so I actually thought that it is something that I've got genetically, and almost all the symptoms are very similar. So you never thought it's something abnormal, and slowly, but like how Niti tried, I tried every possible diet. I used to work out. I was in dance classes also, and at one point I had stopped. I had a very bad relationship with food. Like I stopped almost. I started eating only salads, too desperate for all the results. But slowly I was, like how Niti said, I was losing weight from my upper body but not from my lower body. A very hardly, a little bit of difference was there, but not much of a difference. And also I felt demotivated, but at the same time, when you're so enthusiastic about losing weight, you constantly go and check on social media finding a solution. And that's how I actually came across one person talking about this problem, and it just clicked, like all the symptoms are matching to my symptoms. And the moment I researched about lipedema, I came across Dr. Srinagesh's page, and I directly went and contacted him, and I took an appointment, and he had diagnosed me. So that's how I came to know that I had lipedema. In my case, it was very easily accessible.
Okay. I think I think this is an issue with everybody around. I think Dr. Srinagesh can always say this, and since I've been associated with him since a period, and I know this problem. What you're trying to say is with everybody, they don't understand. They try to treat it like it's obesity and everything like that. But also there is an issue that I've seen. We've diagnosed so many people, and people get confused. I'm sure you got diagnosed, but you still it takes time for you to believe. How was it
Yeah.
after you diagnosed? What was your thought that you really need? Because surgery is something that we all are scared of. I mean, I personally, if I think today that if I have to undergo a knife, I would definitely have curiosity questions in my mind. And of course, you ask these questions. Some of them you can ask to the doctor. Sometimes you feel, can I ask, can I not? Is there something like that that came across you, and you thought over it? What was your mind once you were diagnosed? Before you went and you decided, I'm sure you took your time and you took your things, but what went in your head and what was it? If Sukun ma'am, you can take it first and then pass it to
Yeah,
Neeti.
I'll talk about it. So, 2 years back, I had gone to Dr. Srinagesh. Like how I said, immediately when I found out about this problem, I wanted to know if this was my case. And yes, he had diagnosed me with lipedema. And initially, he told me that there's one solution, only one solution, that is liposuction. And he very clearly told me that if you want to go with the water assisted liposuction. Don't go with other kind of liposuction that is not suitable for lipedema. And I had heard about this, but the very stereotype that surrounds liposuction, I was not that much comfortable with it. Also, with the scars the thought process that goes is, you're going under a knife. What about the scars? What about what if something goes wrong? And the stereotype of, like, how am I going to say my husband that I have a liposuction, or in my future husband, I'm sorry. So all these thought process comes in your head, and it's like basically a very stereotype that surrounds around any cosmetic procedure. Later, it took me 2 years. So doctor told me, if you don't want to go with the liposuction right now, you can try some compression garments and compressive therapy machine. So I tried using compressive garments and a compressive machine, but initially what happened was, I could keep up with it, but because of my office and the daily schedule, I had a very hectic schedule, so I lost the practice of it. So slowly years I started controlling my food intake, but in the back of my head, I it took me 2 years to accept that I can go for the surgery.
Right. Neeti ma'am, something from you that you would like to share on this experience?
Yeah, so like Sukoon said, that it's very hard to accept in yourself that you have lipedema, and the only actual procedure that's gonna work is liposuction. And like usually we associate liposuction with cosmetic thing, like mostly celebrities or actor or actors do it. So it's not a very open minded procedure. Like it's very frowned upon in India. Like people will always tell you to accept yourself and do this and that. So for the first time when I found that I might be having lipedema, so it took me 2 years to finally admit to myself and to my husband that I might be having it. So and after that it took me another 2 months to, like, to take an appointment with Dr. Srinagesh. I was just, neglecting it, like okay, I might do exercise, I might be able to do it. But there comes a point when I was like, okay, for years, like it's been around 12 years or something years that I'm trying to exercise, and I'm on very less food intake, like very minimal food intake, and nothing is changing in my life. So like why cannot I have an open mind, and what if I'll tell my family and they'll have it, like they'll be able to accept me, and it's a disease actually. And it's not like that I'm doing it for like physical artificial thing or something. It's a disease, and it should be like there should be some awareness, and I should be able to accept it like that. So once I was out of that phase, that and I accepted that I might be having this lipedema. So like in a month after my first appointment with Dr. Srinagesh, I scheduled my procedure. But the initial process is very tough to accept it that you might actually have it.
Right. So I think we all have the similar experiences that you guys have shared. It's very similar, and I'm sure there are so many people around who have the similar kind of experiences. Sir, how has it been with you since you've been treating so many people? What is your one message for the world to understand, or especially in India to understand? I also know you get patients from Bahrain, you get patients from other Kuwait and other places also. But what is your one message that people should not be worried about? Because I think it's a treatable or a curable disease. I don't know how do you name it, but is it treatable? Is it curable? Uh, and what is it that people should not be worried about? And how soon do you think they should get diagnosed and treated across? What's your message there, okay?
Actually, lipedema is a progressive connective tissue disorder. So it is a progressive thing. It is not going to stop. So it is a continuous process and an ongoing process. As long as the hormones are going to play havoc on the body, the lipedema is going to keep progressing and keep on increasing, and the fat keeps accumulating and accumulating. So and the liposuction process done for lipedema is a different kind of a process, and very safe. So it is, yes, like any other liposuction procedure or any other surgical procedure. Initially, there would be some amount of apprehension, some amount of pain, some discomfort, and some kind of things which the patient has to go through after the procedure is done. But these are all very temporary issues, and once they overcome those, the first 2 or 3 days is quite will be quite bad for some people. For some people, it might extend to a week. But after that, during which time they might even come to a feeling that, why did I go through this? I should never have gone through this. This doctor, fooled me into it. He, tricked me into this. And these kind of feelings do come in. And then only after the initial phase is over, then they realize, that they have not made a mistake, that they have gone through this particular procedure, and then they come for the next procedure. And once, and for each time, we take off a sizable amount of lipedema fat along with the normal fat oil as well, because these two are, we cannot isolate them or separate them out. So, normal fat as well as lipedema fat, both of them, approximately around 60 to 80% of the fat is removed from that particular region. So even if they're for that, 30% remaining, 30% which is remaining, if that has to come to 100%, is going to take an effort even for the hormones, misbehaving hormones in the body. So, even and this earlier they get the procedure done, the volume of fat is lesser, the amount of fat that's removed is, considerable. So, the progression of the disease is either arrested or slowed down, I would say. I would not say arrested, because there is still around 20-30% fat remaining, lipedema fat. So that will keep increasing in size. But the progression is quite delayed or arrested to a certain extent, so that in the next 10 to 15 years, they can lead a very comfortable life. Some of them won't fit into the garments. So those people who are not fitting into the garments, they start fitting into the garments. Some people, their lower body is so disproportionate from the upper body that they're not able to wear proper clothes. They feel depressed and feel very unhappy, very thing. So these people, when the size reduces, like for example, one of uh, my clients, she said that she was 50 inches on her waist before surgery, hips before surgery, and after the first surgery, she has come down to 42 inches in a matter of around 3 to 4 weeks. So that makes a big, huge difference. So they start getting, instead of they going to a double XL in the bottom, they come into a L or something like that. So next surgery they're more confident that then they may come, and fall into the right sized clothing. So all these things, do make a big impact on the patients. And if they are planning to have their, get married, or they're already married, they want to have children, other things. So during pregnancy, the hormonal influence also, plays havoc. So yeah, so the hormones cannot act on the fat that has been removed. It can act only on the fat
Right.
that is remaining. So the effect is going to be much lesser. The impact is going to be much lesser than, after they get the procedure done. So if they were in, let us say, stage one or stage two, they, after pregnancy, they might go into stage three, or go into early stage four straight away. So, and then the treatment may become extremely difficult for the doctor as well.
Right. So just one thing before we have to have the thing from you is that so you've been treating lipedema in India since a period, and you were the first one to come in India and say that there's something called as lipedema, and you've been loud about it. What has your experience been from the day when you started talking and today? Since I know that your book has been downloaded by so many people and you get so many questions on your Facebook group, you've also initiated to come up with a Facebook group for lipedema people so that they can understand, ask questions, educate themselves, and get it done. So, what is your experience been when you initially started and today? Do you think that people have now understood, and is that conversion or is the thought processing working better than before?
See, initially, it was scary even to talk about lipedema, because of not only legal issues, but even doctors would not accept that. Even today, doctors don't. Not many doctors accept that lipedema is a disease condition. So they brush you off, or sometimes they can be even sarcastic. Sometimes they may just okay, they may not really be sarcastic sometimes, but they don't. Uh, they may even say, okay, I look into it. You know, these there are a few words which mean, to hell with you, or keep keep it to yourself. Don't try to fool others. It's a subtle way of saying that. A nice way of saying these things is what even now I do face this kind of debates. It is, and even patients, is people, general public also, when you want to educate somebody, they may not be interested in these things. So it is only those people who are having this particular problem understand the gravity of the situation. And those who are symptomatic, those people who may be having this particular problem, but if, like, Sukoon was saying, that, my mom had it, and so I also had it, and I thought it was normal. So these kind of things, if they're not symptomatic, they think it's normal, and they pass it off.
Absolutely.
And unless they really have some issue, so it is highly important that we as individuals talk to people, so that and share our experiences. Only then people will start opening up. And India, is unlike the West. India is still not a open society. It's a closed society, and a lot of family bonding and other things. So social inhibitions are quite a lot. So we have to really, we have to open up. Only then other people, the message will spread on to the other people.
I think you've already done a great task, sir. I know this personally because I'm very much well associated with you. So I have seen, I was myself not aware what lipedema is. I got to know about it from you. And like, I remember incidents that we've gone to hotels for dinners and you try to identify people who may be lipedema thing, and which is a very good thing because I think it's very important to people get educated and aware. And I think I'm glad that social media is one of the platform which is helping a lot of people to diagnose this. It's not just the
See,
fun or the
the thing is, being a doctor and a plastic surgeon and a person who has got some knowledge on lipedema, uh, when I walk on the streets or anywhere, walk into a mall or something, like, I see some people having lipedema. No, I can't go and approach them. Unknown person say, "Hey, you have lipedema." I'll, they'll just give me one rap on the face. Or they might even lodge a complaint against me, and I'll go beyond words. So
but I think your website, your ebook should be downloaded, should be shared with people because I think obesity in India is a very big issue. People always get misunderstood, and I think what Sukoon ma'am mentioned or what Neeti mentioned, that I thought my parents had it and I'm going to live with it, is the misconception that people have. Sir, we know you have to head out for a surgery, but one message that you want to give to everybody and put up, and I'm going to have the last messages from both the warriors about their message to the people. But I would like to start with Srinagesh, since we know you have to head out to a surgery. Also, a thing you've already promised that if anybody has any questions, they can feel free to DM it or they can write it in the comment box, and Dr. Srinagesh will personally look into it and reply. My request to each of the viewers or the people who are watching this is please go on the website that has a lot of information that Sir has created, and it's an eye opener for a lot of people. You can be a person like both the warriors mentioned, they saw somebody's video which gave them an idea, and I think these two warriors have been the ambassador today, and many people will watch them and get the idea that this could be one of them. So, sir, one quick message from you to everybody about lipedema in India or across the world.
the thing is, I first I should appreciate Neeti and Sukoon for having braved out to come forward and be a brand ambassador for this lipedema, and be open enough to share their experiences. And I think more and more women, they should not feel shy or scared about this particular condition. They know that they have it. It is there. It's like anybody having diabetes or hypertension or a heart disease. If they have it, they have it. You don't have to feel ashamed or feel scared or feel bad about it. You should, you have it, you feel good about it, but get treated. So you don't have to be you don't have to go into that stage of disability or unhappiness or discomfort and misery. Get it treated and just maintain it, and you can lead a near normal life, or why near normal, you can lead a normal life and be happy. And in
One
fact, I should also say that Sukoon, she does she exercises like nobody's business, and she keeps so fit. I feel envious of her. Every time she walks into my chamber, I tell her, I feel jealous of you that you're able to do so much, keeping yourself fit. I'm like a lazy guy who's doing nothing. Uh, so she is uh, sort of, she instigates, and she makes me feel jealous, and forces me into doing something. She is a big motivator.
Right, sir. So there's one question in the comment box. I know you're going to take questions later, but is this lipedema something that is only for men's, or is it only for women's, or is also men's not exceptions to this?
See, 11% of women across the globe have lipedema, some sort of lipedema, sometimes symptomatic, sometimes some asymptomatic. And there are five types of lipedema. So, so that adds to the confusion about lipedema.
Right.
And there are
But
four stages
can
of
a men
lipedema.
have?
Men can have lipedema, but it's extremely rare. Almost one in a lakh do have lipedema. And those people who are got no, the female hormones in them are more proactive than the male hormones. They can have lipedema.
So something like gynecomastia, which is probable in a man, could
Yes,
also be an activity like lipedema.
yes, yes.
Right, sir. Thank you for your answer, sir. I know you want to head out to a surgery and we're going to have more questions coming to you. You can always revert them back on the comment box and other things up.
Sure.
My question further goes up to Neeti ma'am and Sukoon ma'am that how do you think has things happened? Before I give ask you for a message, I want to also understand, and I think all our viewers want to understand because there's somebody said that how difficult was it to overcome after the surgery? Was it a challenge? Was it a easy process? Like sir already mentioned, it could take 7 days where you may think that why did I do this and what is happening. And I think that's what sir has given as a disclaimer that this could happen, but post 7 days your feel is different. So could you share a short thing about how was it after the surgery was done, and how was it when you felt that everything's fine? What was the duration and what went across your mind? I'll have Nikki ma'am answer it first and maybe pass it to Sukoon ma'am.
So I just completed 2 weeks of my surgery, and before the surgery, I talked to Dr. Sita Lakshmi ma'am, and she was very frank about it. Like, first week is gonna be tough, but after that, I mean, like, it's more of a mental thing than a physical thing. Like, all women, like, we went go through everything, like periods, labor, and whatnot. So I feel physical pain is one thing, but also the mental thing that you are not able to move for like 1 2 days, and like for smallest thing you'll be needing help. So pain, for me personally, I feel I have a little bit more I feel less pain, but for me it was a mental thing. So for the first day after the surgery, I was like, God, why did I think of it? And like, why I am not able to move. Like, even with the slightest movement in my leg or any shake in my bed, I was feeling a lot of pain, like a lot of pain. Also, like, I was not able to do the smallest thing, like get up on my own or drink. I have to lie on my like front part of my body. I could not move the legs. So it was very bad, but every day the recovery was exponential. Like, if I'm feeling the pain 9 on the first day, then I was feeling like 5.5 on the second day. So every day it was like exponentially I was getting back to my routine things, and I was feeling much better. So I feel starting 1 week is difficult for every patient, but the people I have talked to about it. But you just have to be mentally strong and get through that. It's so worth it.
Right. Sukun ma'am, can we have your opinion and went across you?
So it's been 6 weeks now, not almost 6 weeks now since my surgery, and I can tell you very frankly my whole process. So the first 5 days, I would say, is the most confusing days, because initially when you're done with the surgery, your whole leg, for me it was the legs. So any part of your body where the surgery has been performed will be completely numb and heavy because of the anesthesia and because of the fluid, and it feels very heavy initially in the first 5 days, and that makes you overthink that, oh, have I even lost fat or not, or why is my structure looking the same. Because you have to understand that liposuction is not going to make you look drastically different, it's just going to improve your contour of your legs. So initially when you're wearing compression garments, obviously you cannot see your contour and everything, and because of the swelling there is a lot of confusion, like like whether I have lost weight or I've not lost weight, or is this working or not working. But initial, after the 5 days, I would say 5 to 7 days, 7 days also very tough. After the 7th day, 8th, 9th, 10th day is comparatively more lighter on you, is because you start seeing, okay, fine, the swelling is slowly coming down, and now your small scars are also getting healed. So you have the confidence also to look at your legs. Okay, now it's looking fine, it's looking better. And then after 10 days, I would say 10th to the second week, that will be a 10 to 15 days, it will be like feeling, okay, now this is now you've started to accept it. Now, yeah, now you can see some changes and you're more confident about yourself. You can probably move around more easily, so it gives you a more ego boost. And you can do a lot of small healthcare things also, so it makes you more comfortable and it makes you more confident. Obviously in the first 15 days, I feel you should be more careful in terms of keeping your skin very clean, healthy, not doing little bit of physical activity, but not over doing it to yourself. And being very positive to yourself can help a lot. I mean, just be positive, like this is at least better than what you were going through the last couple of years emotionally. So just be confident ki at least something is better than nothing, and go with the whole process. It's a very progressive, I would say. It's not, the surgery is not like other surgeries where you can just see the results immediately. It's a very progressive healing. Every day you'll see different change in your body, like how Neeti said. And after 2 weeks, I would suggest people to go out, do things that is very similar to your daily lifestyle, because it gives your mental health a boost. And the more mentally you feel, like you feel healthy, the more physically you start feeling healthy. And after 3 weeks, you will suddenly start. For me personally, I started working out after 3 weeks. So for me, that helped me a lot, because agar main gym ja rahi hu and I'm seeing that, okay, this movement, it's like a physiotherapy. So slowly after 3 weeks, I would suggest anyone to go do small physical activities, so that it becomes like a physiotherapy. Your nerve endings start working, your stiffness starts reducing, your skin starts becoming more normal, and your body starts healing more faster. And yes, 4 to 6 week, you will actually see ki, yeah, this is something that was worth it to you. And I think then you start understanding this whole process is actually worth it. Yeah.
Perfect. So I think we've already had the best of the replies from you guys, and I think I want to once again thank you both, because coming up on a stage on a digital world and sharing awareness to people, I am sure you guys are going to be an eye opener for a lot of people to identify that they were lipedema. They can consult with Dr. Srinagesh or with any doctors to know about this and get awareness, because it's very important. It's a not a very high spoken topic, but I am sure a few years down the line this is going to be a very normal topic, and it's going to be like people want to know more about. And when they search, I mean, if I try to write lipedema in India, of course Dr. Srinagesh is the top one on Google to be spotted, not just because he's doing it, but because he's been speaking about this since a period. One message that you both want to give to the audiences about, if I am not lipedema also, how should I consider this live? Should I share it with people around? Should I talk about it? Or what do you want to put it up as? A short message from both of you, maybe with Sukoon ma'am to start with and Neeti ma'am to follow up.
Yeah. So I would suggest people who are having lipedema, or not people who are not having lipedema, is first be patient with your body. Start accepting your body, because I feel till you don't accept yourself, you'll never go for that surgery also. Because it's very important for you to have a very positive mindset towards your body. That's going to help your healing process. So when you're reading about it, or you're even becoming aware about it, don't obsess yourself with so much of information also. Because when you start seeing too much, it can also stress you out. It can also like play with your mind, and it can emotionally trigger you also. So awareness is important, but keeping that balance of awareness and finding a solution is more important. Don't stress about what are the faults and what is going wrong in your body, rather see a solution for it. So once you start finding solutions, you automatically start stressing less about the problem and start finding solutions on how you can heal yourself better. And that's going to help you have a very healthy lifestyle ahead also, like this. And for people who don't have lipedema, please be patient with people who have lipedema, because it's not obesity. I've seen my father being like kind of impatient with my mother. And I would suggest people like especially husbands or like family members with people who have lipedema, just be patient with them, because you don't know what's going on in their body emotionally, physically. So be supportive for them.
Okay. Something for you, Neeti ma'am. Something that you would like to tell.
So, like Sukoon said, that it's more of a mental journey, and uh, I would suggest that people with lipedema, or like if even if they are confused that if they have it or not, at least get his diagnosis, because I know like right now insurance doesn't cover anything in India, even in the world they doesn't cover it. So there are preventive measures. Like I mean, like preventive does not mean that it will. Stop you from having it, but it will stop at a stage, or maybe at least the progression that is happening will reduce to some certain pace. So at least get yourself diagnosed first, like if you have it or not. And I feel there is a lot of wrong information available, because I'm not sure, like in India, like Dr. Srinagesh had lot of experience, but there are other doctor, like other doctors who has not done any surgery, but they are like, okay, we'll be able to do it. So get the right information from the right person, so that it will lead you to follow the right direction. So having a surgery or not having a surgery is absolutely your choice, but making sure that you are going towards the right path is the correct way to follow.
Perfect. Thank you, both of you. And like I always say that this is an informative platform. We are not trying to create any kind of fear, scare, or anything across. This is ideally to create awareness about the disease. Many people who think that they are dieting, not able to lose weight, it could be lipedema. You should always go across and rule out the criteria if it is not lipedema. That is what we'll always say. Dr. Srinagesh is available for online consultations and communications through the websites that he, and he's created an ebook which I'm mentioning since I've started this chat, but I would say that it is a fabulous way to read through, and it will help everybody to understand basic questions about lipedema and things like such. It's not a well spoken topic, but it will be one of the biggest spoken topic tomorrow. Like sir said, 11% of women are under lipedema. So if you're trying everything, and this is my message to each of the viewers in this group, if you're trying everything and you're not able to get a solution towards your obesity or weight loss, it could be something else. So do consider considerations and go across. Uh, the people who have joined us today, the lipedema warriors that we call Sukoon ma'am and Neeti ma'am, have shared their experience, and these are realistic stories. They're not here to impress or talk about things, but they are here to just help you understand or help you at the right time, because it's also happened when people realize this in a very later stage. And I know few cases that has come to us in lipedema.in on the website, and we could not say that this is the best time for you to get under it, because when the time starts passing out is also not a right thing. So getting early diagnosis is very great. Whether you are married, whether you're thinking to get married, whether it's happening, it's a normal surgery which is done by the right expert, and well said by Neeti ma'am that it should be diagnosed and done by the person who understands lipedema. So there may be many people who understand lipedema, and there are many people doing it. In Europe, it's a well done surgery. I mean, it's been done since a period, and people talk loud about it. In India, it's newly started, and I think it's going to be the topic. So thank you all the viewers. Special thank you to both the Lipedema warriors. On behalf of Srinage sir, I would like to thank each and every person who logged in to check this up. If this story doesn't have anything to do with you, share it among your friends and families, because you never know, somebody gets an understanding of lipedema and something got up. So next time, rather than telling somebody you're fat, you're obese, you're this, you're not dieting, I think share them this story, because you could be one of their survivors, you could be one of their angels to tell them what is going wrong in their body and help them up. And I think that's the great thing, that we all are here to do it up. So thank you once again, Neeti ma'am and Sukoon ma'am, for everything that you've done it for us. And thank you on behalf of Srinagesh sir. If there are any questions, feel free to write them in the comment boxes. You can DM on the website. You can also write us on the website. You can also DM on the Insta account that we have, Lipidima by Dr. Srinagesh, or feel free to write on the comment boxes. Dr. Srinagesh would personally revert and reply to everything that we have. Thank you, everyone, and thank you for logging in for this episode.
Thank you.